All right, welcome back to the Elias Macko Show. So happy that Aaron Derfel, the wonderful health reporter with the Montreal Gazette, is on the line this morning. Aaron, welcome back to the program. Aaron, are you there? Oh, well, we'll try and get Aaron on the line here. We're hoping to speak with Aaron Derfel. A story out in the Gazette this week is about family doctors. Now, get a load of this. The number of Quebec family doctors opting out of the public health system has jumped by over 9% since last summer, with 557 now legally billing their patients directly. You know, you hear this number and you wonder just what is happening, right, to public health care in the province. And it should be pointed out that Health Minister Christian Dubé, he's made some efforts to stop this exodus, right? But perhaps hasn't gone far enough. Let's find out from Aaron Derfel, who is now on the line. I have it on good authority. Aaron, welcome back to the show.
Yes, hi, Elias.
So why is this happening? Why is the number of Quebec family doctors abandoning ship on the public system, going to the private system? Why does it continue to rise?
Well, for the longest time, just until recently, there was this loophole in Quebec that allowed doctors to opt in and out every few months from switch from the public to the private systems. And that really fueled this exodus. There are other reasons, too. A lot of doctors are frustrated with the red tape and the working conditions. So they've gone over to the private sector. And on Thursday, the CAC government adopted Bill 83, which I don't know if it closes the loophole, but it restricts it because previously, doctors just had to inform RAMQ, the Medicare board, that they were opting out, and now they would have to seek authorization from Santé Quebec, to be able to do so. So that it's not a given. And one of the concerns, of course, about this legislation, it doesn't address the fact that there are 815 non-participant doctors. That means that they can bill patients directly. In the rest of the country, in all of the provinces and territories, it's 13.
The disparity there, Aaron, is just simply striking, right, between Quebec and the other provinces. So let me ask you, Bill 83, what is your take? Will it close the loophole, and will it solve some of the problem here?
So when Dubé announced it, you'll recall the first requirement is that students who graduate from medical schools, which are heavily subsidized by taxpayers, that for the first 5 years they need to stay in the public system, that's or face stiff fines, but it doesn't address the fact that there are 815 doctors who've opted out, and then facing criticism, he then closed this loophole. But whether this will work or not, I just think that, for example, if you review the data, top of the list of the medical specialists who are quitting Medicare are dermatologists, and I think the market for them is strong enough that they can practice outside of the public system. Mm-hmm. So I don't think this law is going to make a difference to them. And I think overall it just speaks to a failure of the public system in Quebec.
And I guess it also speaks to the number of Quebecers willing to pay for their health care, despite the fact that they're paying it already with their taxes. There's a broad swath of Quebecers that are willing to go to the private system, whether it's for family medicine or things like dermatology.
Yes, and I'm glad that you mentioned family medicine. So what this did, when Dubé announced that Bill 83 last summer, there were concerns that this would trigger, it would accelerate the exodus. Because some doctors, especially in family medicine, that's what I found out, is that there were 4 family doctors since July who went over to the private sector, anticipating this legislation, not knowing what would happen. Mm-hmm. So they decided to pull the trigger, if you will. And in terms of Quebecers, patients, there are people who are waiting for a hip or knee replacement. They're waiting in pain. There was a Supreme Court ruling that had judged this to be a violation of security of person many years ago, and so these waits are excessive, and people, their situation deteriorates. It no longer becomes really elective, but more of an emergency. So they're fed up. They've paid taxes all their life, and then they're spending $15,000 to get the procedure, or sometimes a bit less, to get the procedure done in the private sector. And the irony was that the same surgeons who orthopedic surgeons who were in the private sector, once they opted out, they were able to do it in a private hospital, to get it, and these patients would get it done sooner. In the case of dermatologists, you can get an appointment tomorrow. I mean, in the public system, impossible. Yeah. If you want to get an appointment tomorrow, yes, you can get an appointment, but it'll cost you $250. So you're supporting Medicare through your taxes, and then to jump the queue, you have to spend at least $250 per appointment with a dermatologist.
Anything to be said that these changes, Bill 83 and the other changes that Christian Dubé has made, will have unintended consequences of making more doctors leave Quebec and head somewhere else?
That's an excellent question. I do think that that could spur some people, some medical graduates, into leaving the province. I don't want to harp on this, but already, the linguistic rules are not that attractive for some doctors.
Yeah.
I had spoken to a longtime physician, Salim Razik, who left Montreal for British Columbia a few years ago. He was growing just fed up with a whole bunch of things. This is definitely, it's not going to help.
Aaron, we're going to have to leave it there. I want to thank you so much for coming on the program this morning, and your wonderful piece in the Gazette this week on that exodus. Thanks for joining us.
My pleasure.
Aaron Derfel is health reporter with the Montreal Gazette.